Hey, friend, welcome back to the podcast. Today on the show, I have a very fascinating and interesting guest, Sean Lawlor. He's going to be talking to us about psychedelic-assisted therapy. So my view of psychedelics was way back outdated, back in the times where it was the hippie revolution and what happens there. But now we have so much more data coming out from Johns Hopkins University, the MAPS program, and really looking at different psychedelics and how we can use them as therapy to overcome many different traumas that people have experienced, or even addictions. They've been looked at in resistant depression and so much more that we get into on this podcast. So I wanted to have Sean on the podcast to educate us and to introduce him. He is an author, traveler, and psychedelic therapist and regular contributor to leading sites on the topic of psychedelics, such as Psychedelics Today and Psychedelic Times. Sean has a Master of Arts in Clinical Mental Health Counseling from Naropa University, and he has been trained in ketamine-assisted therapy, MDMA-assisted therapy, and internal family systems. He currently facilitates ketamine therapy at a clinic in Fort Collins, Colorado. I wanted to have Sean Lawlor on the podcast because he recently came out with a book that I found fascinating. It's called Psychedelic Revival, toward a new paradigm of healing. This book is fascinating. As you can see, if you're watching on YouTube, I've marked it up extensively to prepare for this interview and to even educate myself on how these medications work on the brain and their powerful properties in healing trauma. Now, I wanted to bring Sean on the podcast to educate us around this novel therapy. May not be approved for use in your state, but just to know that there's options for people out there who may be struggling and suffering due to trauma in their life. And so I wanted to shed light on this topic so you can be informed and help those who may need additional ways to be able to manage and really cure their depression or their trauma. So please enjoy my discussion with Sean Lawlor. Welcome to the Health, Habits, and Epic Living podcast. I'm your host, Dr. Sherry Price. The goal of this podcast is to educate and enable empowered women to take the next step towards achieving their health, wellness, and lifestyle goals. Let's get started. Well, welcome to the podcast, Sean. It's a long time coming that I've wanted to do a podcast on psychedelic-assisted therapy. And so it's here. And so I have a bit of excitement and a bit of nervousness. I'll just be honest with the audience, but I really, really enjoyed your book. I have to say it was so well done. I enjoyed the stories. I enjoyed your intellect and your knowledge in this area. So to get us started off, I thought a great place to start is kind of with my own brain, in that psychedelics, I think, have been misunderstood or lots of misconceptions about them. I know I had kind of thought of them as blackball things and taught in pharmacy school that these are dangerous drugs. And so I didn't really explore them until recently, learning about them and seeing how they can help humanity, how they can help society, there's so many therapeutic uses. I understand that they are looking towards helping people. So I just want to start off, because if anybody is listening to this and they've really not experienced psychedelics or haven't heard the term since the 60s or the 70s, what misconceptions, and I'll talk about some of them I had, right? That, like I said, they were dangerous. You can harm people. And these weren't for therapeutic use at all. They were just solely recreational, were some of the thoughts I had. So I'd like you to start with elaborating a little bit on the misconceptions people have about psychedelic-assisted therapy.
Yeah, absolutely. Firstly, thanks for having me on the show, Sherry. It's good to be with you. So I think that a lot of people don't know, myself included, before kind of going down this rabbit hole, that before the kind of infamous 60s, when psychedelics kind of went down a path that wasn't exactly ideal, there was a lot of research going on in the academic institutions and other settings as well, in the United States and abroad. And it was research in psychedelics for a variety of mental health applications, primarily LSD. It was being researched for alcohol use and for anxiety in patients with a terminal diagnosis. And it was showing some amazing results. And then the 60s kind of happened and kind of took the focus away, I suppose. I mean, it was very loud, and the counterculture kind of adopted LSD as a sort of rite of passage tool and sacrament. And, I think most of us know of some version of that story, at least to an extent, that there was a strong resistance against the Vietnam War and a strong resistance against kind of the status quo in general. And it was very much like cultural movements against the government. And so the US government kind of focused to squelch that rebellion in a lot of ways. And one way they did that was to target the drug use, their LSD use, and kind of rapidly change its legal status and make it illegal. And so at the end of the 1960s, Richard Nixon passed the Controlled Substances Act that just kind of made all known psychedelics at the time Schedule 1. And that's kind of the highest level of penalty, and basically no accepted medical use, no accepted use in any way. It's just purely bad. So that did bring about a good amount of propaganda that was quite widespread and continued through the ensuing decades and the kind of relaunch of the war on drugs in the 1980s under Reagan administration. And so I think that a lot of stigmas honestly come from that. There were some misconceptions and just straight up propaganda that was being funneled into the masses, such as like one hit of LSD will make you go permanently insane or will scramble your chromosomes, which I still don't understand what that means, but that was something that's been disproven. By the same token, there are risks involved with psychedelics. And so, I don't think it's a good idea to just kind of point at that and say like, oh yeah, none of that's true. These are just purely good. Like, they can be destabilizing and they can be used in negative and harmful ways, and they can be connected to abuses of power. The extreme example is kind of the Charles Manson situation, which doesn't come down to psychedelic use, but that was a part of it. So I think that we just have this opportunity now to kind of evaluate like, okay, well, this is propaganda, this is science, and we have so much new science coming out across the world about a variety of different substances that can show us like, hey, in this particular setting or this context, LSD or psilocybin from mushrooms or MDMA or ecstasy, as it's often nicknamed, or other psychedelics can be amazing for this variety of mental health conditions. But care is really important, intention is really important, all these factors to kind of use it in a particular way rather than to say like, oh, the drug itself is the solution and the answer. And, on the opposite side of that, if it's used in a not great way, it can go poorly and lead to harm.
Yeah, I love that you brought out both sides of it. These can be used in a safer way, just like any pharmaceutical agent, any medicine really has side effects, has ways or populations we wouldn't use them in because the risks can be outweighing the benefits. So staying in this vein first of when they are potentially used, let's look at the scientific way with the MAPS that's been brought about, and you can expand upon that if you'd like, and what they're trying to accomplish out of the Johns Hopkins University. And specifically the drugs, we can mention them and we could talk about them as a class and then get into each of them individually too. But really this psychedelic-assisted therapy and where the science is going. I know some of them are being looked at for PTSD and have been shown to be very effective in the trials that have been presented, depression. When we're talking about the psychedelic-assisted therapy path, can you just elaborate on that path a bit, how they're being used scientifically and other conditions that maybe I didn't discuss that they're being looked at for its therapeutic use?
Yeah, absolutely. So you mentioned MDMA, which is also called ecstasy, but there's a kind of caveat to that, which is ecstasy is kind of a street name for a drug, and It's not always MDMA, like in certain settings, not unregulated settings. It might have adulterants involved. So, yeah, that's just to kind of give people an idea of what this is that we're talking about, because more people have probably heard of ecstasy than MDMA. So, that's been researched by an organization called the Multidisciplinary Association for Psychedelic Studies, which is better known as MAPS. And this organization started in 1986, which I believe 1986, which was the year after MDMA was made illegal in 1985. So this was like kind of a later addition to the psychedelic canon than some of the ones we were talking about before. And part of why, the primary reason really why MAPS decided to focus on this and try and reschedule it to Schedule 3 was because it was being used in therapy before it got made illegal, and therapists were finding amazing results in different ways. One of the main ones was couples counseling. Another is for the treatment of post-traumatic stress disorder or PTSD. So that second one became kind of the primary focus of the MAPS' trial, which is an FDA-approved double-blind placebo trial, which again has a kind of asterisk because it's really hard to do a placebo control with psychedelics. Usually people know when they have taken the psychedelic. So anyways, they've been working on this for decades, and basically the general concept of psychedelic-assisted therapy is like, instead of the kind of pharmaceutical model of the prevailing one, at least at the time, of kind of having to take the same pill over the course of a certain, usually long period of time, sometimes a lifetime for certain mental health diagnoses, psychedelic assisted therapy is typically in kind of a contained time frame, usually just a few months. And the idea is that the psychedelic itself, so MDMA in the case we're talking about, doesn't necessarily like do the healing on its own, but it rather evokes an inner process that one can kind of engage in and participate in that then opens up new doorways to healing. So to be more specific, with MDMA, the therapeutic protocol that MAPS has been running for this whole time usually goes for about, I think, 3 to 5 months in total. And there's a combination of preparation sessions, integration sessions, and dosing sessions. The first two don't involve any MDMA. It's just kind of regular therapy, but with the addition of like preparing, like, okay, here's what you need to do to prepare for the dosing days, and kind of taking care of medical evaluations and things like that to make sure that one is like physiologically and psychologically safe. And then in the dosing sessions themselves, often people lie back wearing eye shades and headphones with kind of curated playlists that have been made specifically for those experiences, usually songs without lyrics, to kind of put one into a different brain state than our typical analytical mindset. And so with MDMA, it's kind of known as a love drug. It can really like open the heart. And so that can be really helpful for PTSD, in that people who have suffered severe trauma that still affects them on a day-to-day basis, just a lot of people, and trauma in many different forms. Oftentimes it's overwhelming to even think about the traumatic incident, and other just like day-to-day triggers can kind of bring it up and just immediately kind of speed the nervous system into a fight or flight response or a freeze response. And it's very difficult to kind of change that and to get to the source of that trauma without being gripped in such an intense response, which, happened for a good reason. Like it came online because of the trauma. Things like MDMA and this therapeutic context, with MAPS, it's done with 2 therapists, typically a man and a woman at the same time, for a kind of balance of energies. People are able to kind of touch into the sources and the roots of their trauma and meet it from a different place, so that it's maybe not necessarily seen as like the enemy or the thing that like needs to go away, that's ruining their life, but rather this deep source of pain that they can meet with a kind of understanding and compassion. And so it's like the psychedelic MDMA in this case opens the inner space and the heart space to meet the trauma and the pain from a different vantage point. And that experience can have real transformational power over time. Whereas a lot of other medications would kind of try to reduce the symptoms of distress without actually like getting at the underlying thing. So it's kind of like symptom management. So that was all about that. You mentioned research at Johns Hopkins. The same kind of general protocol for psychedelic therapy takes place, except with MDMA, it's 3 MDMA sessions over the course of the treatment. And with Johns Hopkins studies for psilocybin, the active alkaloid of magic mushrooms, it kind of differs per study. Some of them have had 1 psilocybin session, some of them have had 2. And geez, they're researching so many things and have published research on so many things, from addiction to nicotine for long-term smokers to end-of-life anxiety for people with terminal cancer diagnoses. I think been doing a study on Lyme disease and eating disorders, anorexia. And honestly, this field's so rapidly evolving. There could be 3 more that I haven't even heard of, but they have like one of the biggest research centers in the world that got built in the last, 5 or 6 years through a lot of kind of private funding. I forget what it's called, but you could find it. So they've got a lot of steam behind the work there.
Yeah.
And so many more trials across the world of a similar nature.
Yeah, there was just so much in your book that I've been discovering and opening my mind to, because, I had been closed-minded about these therapies, but in the circles I've been interacting with and helping women overcome addictions, and I've had a personal friend say MDMA alone saved her marriage, like literally saved her marriage.
Wow.
And when I started, then I become curious. And then the pharmacist in me comes out and I'm like, well, maybe these drugs do have some, importance and modality, especially if they're being used by people I respect and by organizations that, quote, are respectful, right? So it started to like change the tide on my thinking and looking into, and you put this in the book, how MDMA works. It's this huge release of serotonin, which SSRIs, right, work to increase serotonin because they don't allow the reuptake of it. And they have this release of norepinephrine, dopamine, oxytocin, like you said, that heart opener. So they became less scary to me as I started to evaluate them with my scientific mind and knowing how these chemicals work in the brain. Because before that, they were just like dangerous drugs. And I thought we didn't know how they work. When I love that now we have the data, they are being researched. And the more I'm asking people, like, how have you healed? Because people know me in the space of drinking a lot. Some people will just pull me aside and open up about their ketamine use or their psilocybin use and how, these modalities have been so helpful. And they've tried many different areas to get better or to control the wants and the desires and the cravings. And so I really like my audience to just be knowledgeable that this is a modality potentially if somebody is looking for other ways to heal. I want to now transition to like what I find is so important after reading your book and having these experiences is that set and setting. I think is, if you're new to this space, really talking about the set and the setting, also reading Michael Pollan's book on How to Change the Brain or How to Change, I can't remember
How to Change Your Mind.
How to Change Your Mind. And he talks about set and setting in there as well as in your book. Can you comment more on the appropriate set and setting? Because I think that could be a major difference between the journey that's going to be healing for the person versus maybe not as healing or possibly traumatic.
I totally agree. Yeah, I think they're just 2 of the most important factors to hone in on, and a real kind of gift we inherited from the 60s research that they kind of figured out at that time. So the 2 things being set, like mindset going in, inner state, and how one's approaching it, and setting, like the physical surroundings and yeah, just the setting of the experience. And both of these just have such kind of immeasurably important influences on the experience itself. There's kind of a dark history with certain LSD and the US government where they were kind of conducting experiments through a project called MK Ultra in the 1950s or so. And basically people would get dosed with LSD in like creepy rooms and bad settings. And, it's not a big surprise they had a bad time and it got freaky and weird. So like a bad setting, for instance, would be a creepy government room with a two-way mirror while someone is like watching you on the other side. Like that would make any person kind of feel on edge at best. Whereas since we're talking about therapy, like if someone has a real trusted relationship with a therapist and feels really comfortable in the office and there's, some nice plants around, like, it looks like you have a really nice space there. Like you just, it feels very welcoming and inviting and calm. So kind of honing in on those things, it creates the inner setting, I think, for the experience as well. It like can just really imbue the trip or the journey or the experience with just a lot of centeredness and safety. And really with safety established in both the set and setting, that's maybe number one, certainly like top three things to focus in on. Like if you don't feel safe, chances are things could go south because these psychedelics can make the mind spiral a little bit and kind of get fixated if these factors aren't kind of honed in on.
I just want to go into that safety because I think that is so important. So if somebody is researching this, and I think having the expertise of the therapist, right? Have they done this before? Are they new to this experience or how long was their training? And I think it's really important that they've had experience with these medications because how are you able to hold space for somebody as they're navigating through certain emotions that may come up? What I loved hearing so much throughout your book is that safety component that needs to be there. Also knowing these medications, and they can bring up different experiences for different people, depending on what we come in with, depending on what's bothering the person. And so providing that setting that's safe, where they feel welcome, like you mentioned, and just the experience of that therapist to be able to hold that open space for them as they journey, I think is so important. And so I want people, if they are investigating, to really do the research on that, really find a therapist that they connect with, can feel safe, because there is a letting go process to this. And if you don't feel safe, you're not going to let go, which means I don't think you would get as much of the therapeutic healing that can occur if you are still holding on to something that your body is telling it's time to go. It's time to let go. So I did want to mention that safety factor, I think, is huge.
Totally. Yeah. And I empathize with it being tricky at the time, just since a lot of these, medicines or psychedelics are still Schedule 1 and they're still going through this process. Like right now, the only like really widespread accessible one is ketamine. And I work with ketamine with clients and all of these things still apply. And I think it's an amazing, amazing medicine. And just because it's accessible, doesn't mean it's less amazing than the other ones, but it's not for everyone. Some people are not drawn to it because it's more synthetic and it's a lot different than something like psilocybin mushrooms. And, that's trickier. So just to empathize with people who are interested and want to have the safe setting, but don't really know where to turn. I hope that changes culturally soon. But yeah, I don't think that point of safety can be underscored enough. And for people who feel excited about it, I think it's really important to slow down and make sure that you can, in full integrity with yourself, say like, this feels safe. Not like, if you feel a little bit on edge, it's good to look at that and think like, okay, how can I feel more safe so that, just like you were saying, I can let go and allow the experience to happen instead of feeling like I need to grip the wheel the whole time, because doing that might just fight the experience. And then that will lead to anxiety, fears, all kinds of different things that will kind of block the power of what these can do.
Yeah. And speaking of the power, you wrote it so beautifully in your book about psychedelics cause dramatic shifts in emotion and cognition. And they help people really dig into the root causes of what's bothering them or their condition. And that's what I feel is so powerful about them, right? As you mentioned, we can treat the cravings. We have medicines to do that or block the cravings, that symptom management. Whereas this has the power with a few doses, with the right person, the right set and setting, of course, the purity of the compound, right? Making sure it doesn't have it's not laced with anything else, right? And having that guided support and having the pre-sessions beforehand to establish that rapport, that safety, prep the mind, prep the body that needs to happen, all of that to make sure that on medicine day, right, the journey can go as flawlessly as possible with, and then incorporating that afterwards, right? It's not just about the medicine and on that day, but you're right, integrating that and the learnings that come from that and the healings that come from that. And how are you going to move forward in your marriage? Or now what's changed for you since you've had this journey or this experience? So I love that you mentioned that to expect these dramatic, or that these could cause dramatic shifts in your cognition, dramatic shifts in how you feel. You have many stories in there where they allow people to leave the past in the past. I mean, how therapeutic is that, right? Just allowing okay, that happened to me, but that no longer do I have to carry that forward. So I love that these could be that somatic healing, that somatic release that people can experience with these medicines. Do you want to dive into more of that somatic? Because I didn't really understand somatic healing as much until I started digging more into this. Can you talk about what that may look like for patients?
Totally. Yeah. I'm so glad you asked about that, because that's kind of bringing the body into these experiences and just how important the body is, because it can kind of be left behind in therapy in general and in discourses when we're just focused so much on thoughts and the mind. But that, I kind of argue in the book, is kind of inherited in Western thought, where there's this long tradition of separating the mind and the body as these two things. And I think somatic therapy, which comes from soma, which I believe is the Greek word for body, I think somatic therapy is one of the things that's really helping bring the body and mind together. And like for our culture, I think a lot of other cultures have known that for a long time, but we still got some training wheels in certain respects here in the West. And we're kind of maybe reawakening to the fact that the body and mind are so intricately connected. Like an example is kind of what I was alluding to earlier about trauma and the nervous system. Like, one of these amazing best-selling books in the therapy space is The Body Keeps the Score.
That's a good one.
So, yeah, totally. It's been on the bestseller list forever. I don't even know how it's possible. It's amazing. But so that tells a lot. And so a kind of core idea of that is that our traumatic experiences prompt our nervous systems to go into a certain state of defense, and that kind of gets stuck in the nervous system. Like there's a way that trauma gets processed through the body. And another kind of pioneer in this is Peter Levine and his work in, I always get a somatic experiencing. That's his modality. There's another one called sensory motor that I get mixed up sometimes. And he kind of alludes to like an animal that is fleeing a predator, and if it escapes, it'll kind of like shake its body, and kind of reading that as like allowing the charge that's taking control of the nervous system in this fight or flight response to release. That there's just kind of this natural, the body knows how to do that. And then they can kind of move on and not feel like they're kind of carrying this experience. But for a whole number of complex reasons, human beings today don't really do that. We can kind of like clam up a little more and not move. And like a part of us, to use language of internal family systems, which is a therapeutic modality I talk about in the book and have gotten training in, their kind of way of framing it is like a part of ourselves gets kind of stuck in the past and hasn't moved on from the experience. And an amazing way to access that is the body, because if the traumatic experience gets evoked, it's not just a memory. It might even be like a full body response before the memory. Maybe you feel it in your stomach or your chest, or like you feel like your body wants to run and you don't even know why. Typically, we kind of like, don't let that run its course, especially, if we're in like a public setting or something like that and worried about how other people will perceive us and stuff. But the somatic therapies really hone in on those feelings and experiences and help use interventions like mindfulness practices, breathing practices, a whole host of other things to kind of widen the window of tolerance and allow people to be with more of that distress and kind of allow their bodies to shake if they need to, or move if they need to kind of engage in this organic process that got interrupted at a certain point. And so to connect to psychedelics, like I hear somatic therapy talked about with all psychedelics, but definitely with MDMA a lot. And since we've been talking about that already, it can really like kind of heighten the embodied sensations that were already there and bring them more to the forefront. And this is important to keep in mind too, just with, talking about setting and safety. And that doesn't mean like the whole experience is going to be blissful necessarily. It might be challenging and it might be uncomfortable, but if you can kind of feel a safety in that, the general idea behind this, and if you can have support around you with a therapist and other people in your circle, maybe that's what you need to feel a little uncomfortable. And it's kind of going into those uncomfortable places where the real deep healing can happen. And so, yeah, maybe someone's stomach feels like really tight or clenched, or something uncomfortable happens when the traumatic memory gets evoked. And then maybe on MDMA, that like just feels like it's totally fully in focus and even bigger. But that opens the opportunity to turn toward it even more and engage in that processing, to let the body move or shake or scream. It's good for psychedelic therapists to kind of know like there's certain responses that maybe wouldn't be there in a normal therapy session that are good and that can be good and aren't signs of like something bad happening, but maybe a process kind of completing. And through turning toward the somatic feelings, so much can come up to limiting beliefs, memories, even just kind of images that don't have any clear connection to one's past, but feel meaningful in a certain way, like archetypes. And the therapist can be there to kind of like help unpack that. So.
Yeah. So important you mentioned what to experience and how the body is just brought into it, because that energy does get stored. And we may know it or we may not know it, right? We may be in touch with it or we may not be. It's all about education and how much your head knows, right? It's almost like leave the body behind and just charge forward in this masculine society about get things done, let's accomplish and get more and more degrees, as I like to joke, more education, right? Because there's a fulfillment to that, right? There's a dopamine hit in that. Sometimes you don't always get the knowledge of why it's there. Your body just needed to release.
Yeah.
And so I think these somatic experiences, right? Because we have a lot of therapies that are cognitive based. I do a lot of cognitive based and learning more somatic based therapies for people. But really that somatic experience can release a lot. Not only that, it really can start to shift the way you navigate life and shift habits. So because this podcast is about health, it's about habits and really empowering yourself to better living, right? Just knowing that this can be a modality where it does dramatically shift your habits. And as they're being investigated for the different conditions, and you mentioned a list of them in your book, which I thought was well more than what I had known about: alcoholism, opioid dependencies, stimulant dependence, post-traumatic stress disorder, neurotic depression, anxiety disorders, phobic neurosis, obsessive compulsive disorder, other personality disorders. It's really a modality that I hope we get to explore and continue to do the research in so that people can find ways to live their best life. So as we wrap up, maybe you can talk about what personally have you gotten out of psychedelic experiences. Maybe that would be helpful if you're willing to share.
Yeah, happy to. One thing I would say of that first question, which kind of popped in my mind just with what you were saying before about habits, is I think the habit shifting is so important. And so the fact that you're doing that work and focusing on that, like every episode that you do of this podcast is relevant to this, even if you're not talking about the psychedelic therapy. And I think that in terms of like the depth work that we've kind of been talking about, it can be helpful to think about how a lot of our habits, from substance uses to use of media, social media, phones, just a ton of different things that we kind of know, like, okay, this is maybe a little out of balance, that a lot of times those habits are kind of coming as coping mechanisms for underlying distress, that maybe they help kind of shut things off a little more, or a whole host of other things. And so even if we're not honing in on those and saying like, okay, I'm changing this, like my mind is focusing and changing this, but rather going toward that underlying pain, that by contacting that pain and maybe experiencing a kind of transformation of it, the habits can kind of change as a result, because then the coping mechanism isn't as needed. There's less underlying distress. And so you don't need to kind of like push down that distress through distraction or whatever it might be. So I think that just kind of gets at one of the tricky things of this work, is that you can't put it into an A plus B equals C formula all the time, but these one's kind of goals or intentions can come to fruition through like a more nonlinear means. And so you were asking also about like some of my experiences and like what's gotten me interested in all this.
Yes, exactly.
Yeah. I've experienced a variety of settings at this point: psilocybin mushrooms and LSD and mescaline, which we didn't talk about, but that's a really, really interesting one. The synthetic compound is the active alkaloid in peyote cactus and San Pedro, another cactus from the Amazon, a few other ones as well. And basically, my favorite definition of these is that they're non-specific amplifiers, which means like they can kind of amplify any aspect of the inner world. And I also just love that the word psychedelic translates to mind manifesting or soul manifesting. And I feel like that's kind of what I experienced early on in my early 20s with mushrooms. I hadn't really thought much about who I am, just kind of going through life in a pretty programmed kind of way. And it was kind of like mushrooms allowed for this experience. It was deeply emotional for me. And I think I had been disconnected from my emotions, partly from just being in a pretty patriarchal setting, and emotional experience among men was not encouraged at best, but more commonly like shamed. And that felt just so liberating, to just feel tears flowing, not necessarily because I was sad, but because like life around me was so beautiful. It was so amazing. And it just like opened up this feeling of aliveness and connection to friends and other people and loved ones. And that was my experience with a lot early on, and really kind of what got me so interested in these, and learning about the research in the United States, and learning some more about different traditions around the world who have used native medicines, plant medicines, for healing purposes in a lot of ways. And then, yeah, it was probably about 2017 when I was listening to Tim Ferriss' podcast. He was talking a lot about the research at Johns Hopkins and MAPS, and even some of his own experiences. And it seemed like all of a sudden all these podcasting people were talking about psychedelics that felt more aligned with my experience, but that felt very different than like the cultural narrative. And so that just kind of tumbled me down the rabbit hole of learning more about how much research was happening behind the scenes, and how much science was coming out, and how much the cultural perspective was shifting. And really just from my own experiences and from everything I learned through reading and traveling and whatnot, it just made perfect sense to me that in the right contexts, these could really, really help people. And I've been so interested in the mind and psychology and consciousness. It just seemed like almost every interest I had in life kind of like converged around psychedelics and psychedelic therapy, but I didn't know how to be a therapist. So I decided to learn that practice, to go to grad school for that and occupy the space of a psychedelic therapist. But yeah, I think ultimately I just really believe in the potential for a lot of healing.
Well, thank you for sharing your experience. And, how you first started really gripped me, because I even wrote it down because I wanted to read it here on the podcast as we wrap up. And I hear this a lot from women I work with as well. So I think it's like a universal kind of principle, in that what drew you at first was, not knowing yourself and suppressing emotions. I too grew up in an environment where crying wasn't allowed, right? You did that in private. The medical system was the same way. We don't cry in front of patients. We have to stay strong for them. So these emotions weren't being able to be fully expressed in a way that felt, quote, safe. And one of the comments in your book that came from a client was saying, I finally am able to feel and be okay with my feelings. And I just really want to pinmark that here in the podcast, because I think as a society, it is healthy to feel, and we need to feel. And just as you mentioned, when you get attacked by a lion, or even my dog sees something and sees another dog that he thinks might be dangerous, he shakes it off. Like, we are meant to be with our bodies and experience emotion in our bodies. And I think so many of the coping mechanisms, as you said, is to distract, push them away, numb them, suppress them, keep them down, right? Because they don't feel safe to be expressed appropriately. And so I love how you found your way and were able to express that here on the podcast. Sean, this has been amazing. I've been really enjoying our conversation. I could probably go on for another few hours because I could really dive into the science and, really help people. And I'm really excited for the research that's coming out. I'm very excited for Tim Ferriss and all the podcasters I've heard talk about their experience and their healing that they've achieved and felt with a lot of their conditions that they've been vocal about, because I think it helps to promote the scientific side of these, the safe way to use these, and really curate a path of like, okay, we learned from the 60s what not to do, and now we're learning what to do. And these can be a powerful way for people to overcome some things that have been holding them back. So thank you so much for being on the podcast. Please tell my listeners if they want to work with you or get your book, on how to do that, where they can find that information.
Sure. Yeah. So I have a website. It's just seanplawlor.com, SeanPlawlor. You could Google my name, Sean Lawlor. I imagine it'll pop up. And the book, Psychedelic Revival Toward a New Paradigm of Healing, is published by Sounds True. You can find it on Sounds True's website, Amazon, Barnes & Noble. And yeah, I think if you plug it in, it should pop up in a variety of sources. If you're abroad from North America, Penguin Random House has a version that they're distributing in other territories, so you could look into that. Yeah, I think that should get you started. And there's a contact form on my website that you're very welcome to reach out through. I always feel excited when I see that someone's reached out through my website for whatever reason, even if just to say hi. So yeah, thanks to anyone has listened. And yeah, thanks so much for having me on the show, Sherry. It was really good to talk to you. And likewise, I could have talked to you for a long time about this stuff.
It's fascinating, isn't it?
Mm-hmm.
Well, thank you so much, Sean.
Absolutely.
Thanks for listening to the Health Habits and Epic Living podcast. If you're ready to take the next step to improve your health, wellness, and lifestyle goals, head over to www.epicyou.com and sign up for my weekly newsletter. Again, that's EPICYOU.com. Please note that the information in this podcast is for educational purposes only and does not constitute medical advice.